Okay, let's look at Medicare Part D or Medicare prescription drug coverage. It is run by Medicare-approved private insurance companies, and you pay a premium to lower the cost of your prescription drugs. Now, every plan has a list of covered drugs or a formulary, and these Part D companies can change their formularies each and every year, so it is important to always check to see if you are on the lowest cost plan for the drugs you are currently taking. Most people will enroll into Medicare Part D plans during their initial enrollment period. This is the 7th-month period that starts 3 months before the month you turn 65, includes the month of your 65th birthday, and ends 3 months after you turn 65. Some other people may enroll during Special Enrollment Period. Most often, this is when they retire and lose employer drug coverage. But there are other ways to qualify for a Special Enrollment Period other than just retiring. Now, if you miss your initial enrollment period, or you do not qualify for a Special Enrollment Period, then you can enroll later during AEP or the Annual Enrollment Period. AEP runs between October 15th and December 7th of each year. Your Part D coverage will then be effective on January 1st of the following year. Now, if you enroll into a Medicare Part D plan for the first time during AEP, you may need to pay a late enrollment penalty. This penalty is added to your Medicare Part D monthly premium. So just make sure to enroll during your initial enrollment period, or at least make sure you will qualify for a Special Enrollment Period if you plan on enrolling into Medicare Part D more than 3 months after the month of your 65th birthday. Enrolling into Medicare Part D is easy. You can enroll over the phone by calling Medicare directly at 1-800-633-4227, or you can go to Medicare.gov to enroll. If you go to Medicare.gov, this is how it works. First, press the Find 2020 Health and Drug Plans button. Then you can continue and create an account, or just continue without logging in if you want to check your options right away. Then just let them know that you're looking for a Part D plan and plug in your zip code, county, and if you are on any special government programs. Then just let them know that you want to see drug costs and how you'd like to fill your prescriptions. The next page is the most important. Make sure to enter your prescription drugs in carefully and fill out all the information as accurately as you can. The last step is picking out the pharmacies where you'd like to fill your prescription. Make sure to pick at least 2 pharmacies so you can compare prices. Then you will get your results. Make sure to sort the plans by lowest drug cost and premium cost, because there is no point in paying more than you have to for your prescriptions. Here you can compare plans and even enroll in a plan right over your computer. Like I said before, these companies change their formularies each and every year, so you'll need to call Medicare or check this website each year to make sure you are on the lowest cost plan for the drugs you are currently taking. You can check this every year during AEP. Again, AEP runs between October 15th and December 7th of each year, and changing your prescriptions during this time will make your new drug plan effective January 1st of the upcoming year. Now, when most of you are comparing and reviewing the details of the different Part D prescription drug plans, you will see something like this in the Plan Details view. You will see a constant number month to month, and your estimated drug cost will seem reasonable for the year. But if you see this and your costs seem all over the place and super expensive, then understanding how Medicare Part D works will be very important for you. Now, a donut is used to represent how most drug plans work on Part D of Medicare. So before you can even get a coinsurance from your drug company, you'll need to pay up to a $435 yearly deductible. After that, you must pay a copayment. And these copayments can be different from company to company and even from drug to drug. So you will pay these copayments until you and the insurance company together have paid a total of $4,020. Then you reach the donut hole or the coverage gap. In this gap, you will be responsible for paying 25% of brand name drugs and 37% of generic drugs. Now, when you have paid a total of $6,350, you move into what's called catastrophic coverage. This is where the government steps in and helps you out. You are then responsible for 5% of drug costs from this point until the end of the year. Thanks for taking the time to check out this quick presentation, and I hope you found it helpful. Make sure to comment, like, and subscribe to my channel for future Medicare updates. And if you are still a little confused about how Medicare works, make sure to check out my Medicare 101 video as soon as this video ends. You will find it in the bottom right-hand corner of the end screen. Have a wonderful day.